Hey everyone, my name is Eric Matheson. I'm a philosopher and clinical ethicist based in Toronto, Canada. In this video, I'm going to explain how to become a clinical ethicist. The first thing I want to cover is what a clinical ethicist is. A clinical ethicist is someone who works in a hospital or for a healthcare system, and we help people address bioethics or any ethics issues that arise in a healthcare setting. So we work with healthcare providers, physicians, nurses, as well as patients and their families. And when any kind of ethics issue arises, a dispute about what the right goals of care should be, some sort of question about what the appropriate path should be that a healthcare provider has, they consult us, we get involved, and we help resolve whatever the issue is. There are so many different sorts of consultations that can come up and so many different kinds of ethics cases that come up. And in this channel, as I move through, I'm going to go over different sorts of cases that I've encountered. But the basics of it are that usually based in a hospital, if something comes up, then you go and help out. Other sorts of things that clinical ethicists do, we do education, so for healthcare providers or for people in the community. So things like advanced directives, stuff around giving consent, medical assistance in dying. And we also do policy sometimes. So if they're, especially for in the hospital about visitation, say, during the pandemic, or what the assisted dying policy should be, we're often brought in to help out with those discussions. There are so many different paths into clinical ethics. This is one of the things that makes it really interesting and an exciting field. The field is going through a lot of changes right now because it is growing really fast. And there has been this move over the last, well, for quite a long time, but really over the last decade, there's been a big push towards professionalization. So it used to be that clinical ethics, a healthcare provider could call themselves a clinical ethicist. Somebody who was a philosopher based in a philosophy department could call themselves a clinical ethicist. And there's now more of a move towards certification and specific training. However, right now, there isn't one single education pathway that you need to take to go into clinical ethics. So just to show that, I want to describe how I got into it and then go over some of the different other options that people have taken. So I did my PhD in philosophy in Toronto, and my dissertation was actually in normative ethics, so about ethical theory. I had TA'd and taught some courses in bioethics, and I published a paper on bioethics, but it wasn't my main research area. It was only in the last 2 or 3 years of my PhD that I really found out about clinical ethics and started to think about it as an option for me. So I had applied for some clinical ethics jobs, and they basically said, the ethics stuff is great, but you actually need to get some experience in a hospital. And so after that, during my last year of my PhD, I asked around all over Toronto, and I was able to do a clinical ethics residency in Brampton, which is just in the greater Toronto area. So once a week, I would go out there for the day and shadow the ethicists out there. When I finished my dissertation, I went on the job market. So I was applying for tenure-track philosophy jobs, postdocs in different areas of philosophy. And then I was also applying for some clinical ethics positions. And that's how I ended up at Baylor College of Medicine doing a clinical ethics fellowship. So the fellowship really appealed to me because it was a mix of academic research. I had 50% research time. And then the other half was a really rigorous training process in clinical ethics. So I knew that my experience in the residency in Toronto, it didn't really give me enough skills to go out and do clinical ethics as a full-time position. So the Baylor Fellowship really set me up, gave me the training that I needed, the experience I needed to then go out and get a full-time job. After that, that's what I did. I returned to Canada and worked as a full-time ethicist during the pandemic. And then since then, I've now come back to academia, and now I'm doing a split. So I do consulting as a clinical ethicist, not usually in a hospital, but taking consults from remotely. And then I'm also a philosophy professor. So I teach classes and I do research. There are lots of different ways to get into clinical ethics, but one of the things that you need to have, one of the kind of core requirements, is that you have to have a terminal degree in your field. For philosophy, that means you have to have a PhD. And for other kind of areas like philosophy, a PhD is the expectation. It's a little bit different in other disciplines. So somebody who goes to law school, who gets a JD, although you can go, there are PhDs in law, that a JD is the expectation, because that is the degree that once you get a JD, you can become a practicing lawyer. So if you get a medical degree and become a physician, or you get a nurse's degree, once again, there are higher degrees available, but because you can start working with the nursing degree, say, that is sufficient for it. So what I'm going to do now is walk through from an undergrad all the way up to becoming a full-time clinical ethicist. Here are the different sorts of things you should consider. The first thing is that if you're an undergrad and you're choosing your major, there's a lot of flexibility. You can really decide based on what your interests are. But there are some majors that make more sense than others for clinical ethics. So philosophy, if you're taking ethics, or if there's a bioethics specific major or stream, that would be a good option. If you're doing other stuff like policy or health studies, health sciences, that those are good options. And then things like biology, physiology, neurology, or neuroscience. Those are all areas that can set you up well for graduate training that you would need to have. That said, there are other majors that don't really make as much sense. So if you have a degree in English, or if you're pursuing a degree in English, there are ways that you could transition into clinical ethics, but it doesn't really make as much sense. Similarly, if you're taking history, history is not really a major that nicely leads into clinical ethics. If you're doing music or drama, those are not majors that nicely lead into clinical ethics. So although there's a lot of flexibility, you still want to choose something that is going to put you on the path to either get the ethics experience, like a philosophy degree, or the medical health science experience, like health studies or biology or one of the other sciences. As you're taking courses, a few things to keep in mind. One is that no matter what, you should take some ethics courses. So figure out what the requirements are to take. You could take Intro to Ethics in the philosophy department, or if there are bioethics specific courses, you should definitely take those. Regardless of where you go from there, if you have a different major, having those ethics courses will give you the foundation that you need to go on and do clinical ethics. You also need to get good grades in whatever courses you're taking. So if you're going to go on to get into graduate school, law school or medicine or whatever, you're going to need to have good grades. The two other things I would say to think about while you're an undergrad, one of them is that you should try to attend some bioethics talks. So if there's a philosophy department, see if you can get on their mailing list or check what kinds of talks they have. Academic philosophers will come through and give talks at most departments. Those are good to attend. That'll give you the sense of the sorts of questions that bioethicists are thinking about or that ethicists are thinking about in general. If there's a bioethics center or if the medical school hosts academic talks in bioethics, those would be even better to attend, because then you can figure out what are the specific questions that people researching bioethics or clinical ethics are wrestling with that they're encountering in a hospital setting. Philosophers sometimes deal with applied issues, but they also love to think about issues that are pretty theoretical. So having a nice mix of that will be really good. The other thing that you should try to do as early as you can is to, no matter what your major, try to get some experience in a hospital. As an undergrad, this probably means just volunteering in some capacity. It's unlikely that it would be something specific for clinical ethics, although if you can shadow a clinical ethicist, that's amazing. But try to get into a hospital doing whatever you can. If that's delivering food for patients, or if that's spending time talking to patients, and acting as a porter, moving people around. Being at the info desk, telling families where to go to get to the right spot. All of these sorts of things are great experience because hospitals are their own world. And if you haven't spent much time in a hospital before, it takes some time to figure out. So the more experience that you can get in a hospital, understanding how they work, the better off you'll be as you move on to other levels of education. Supposing that you've chosen a major, you're working through your major, you're in your last year, and you're trying to figure out what to do for grad school. What is the best thing for clinical ethics? There's not really one single answer. I would say it depends on what your interests are. So for any kind of graduate program or professional degree, you have to be really interested in it or really dedicated to be able to get through it. Medical school, law school, any kind of graduate degree, these are hard programs. And so it's got to be something that you actually care about. The other thing is that if you're totally dedicated to clinical ethics, which is great, then that will give you some direction. But you should also think about what else you might do with the graduate degree in case clinical ethics doesn't work out. You might change your mind. You might decide that there's some other kind of area that you want to focus on more. Or you, like me, you want to do clinical ethics, but also want to do research and other sorts of work. So you can choose something based just on clinical ethics, but it should be something that you're really interested in, you care a lot about, and that also gives you some other options outside of clinical ethics. Philosophy, this is a big downside about philosophy, is that if you get a philosophy PhD, it sets you up nicely to do a clinical ethics fellowship, to go into clinical ethics. But philosophy PhDs are pretty limiting in other ways. So you should really think seriously about whether that's the right option for you, or if there's another degree that might give you a better range of options if clinical ethics doesn't work out. In grad school, whatever that is, or law school or medicine, you can think about clinical ethics as really having two parts. And this is pretty easy. There's clinical stuff involved in clinical ethics, and there's ethics stuff involved in clinical ethics. And so most people will have more of one than the other. So in grad school, you should start thinking about what your weaknesses are in terms of your training, and then try to figure out how you can get more experience with that. So as a philosopher doing a philosophy PhD, I knew the ethics stuff pretty well, but I did not have any experience doing clinical work. I had not really spent that much time in a hospital. I had never demonstrated or trained in any kind of bedside manner. So that was the area that I needed to work on the most. On the other side, if you're a physician, or if you're in med school or nursing school, you'll have the medical clinical stuff really worked out. You get lots of experience in a hospital, but you're not going to have the ethics experience. And so then it's the opposite problem. You have to figure out how can you get some ethics experience. That might be taking courses. There are intensives over the summer that many schools offer where you can get bioethics experience. It might also be doing some kind of professional degree in bioethics. So there are many schools now in the US especially that have masters of bioethics programs that are specifically designed for healthcare professionals. So they're usually part-time or done online or kind of broken up so that you can keep working your main job, and finish it with a degree or a master's degree in bioethics. So you can check those out. I'll put some links to some of the programs that you can look at just to get a sense of what's out there. Other sorts of pathways are a little bit different. So if you take something like law does not really give you ethics experience or clinical experience. So this is why almost all of the people I know who have gone into clinical ethics from law have also paired their JD, their law degree, with a master's in bioethics. And there are some programs that allow you to do both at the same time. So if you get into the law degree, into the JD program, then you can also do a master's in bioethics at the same time. I actually knew a clinical ethicist who went to law school but never intended to practice law. She did really well at law school, but she was also doing a master's in bioethics. And so as soon as she finished her law degree and bioethics degree, she went into clinical ethics. She wasn't interested in practicing law. So that can be a nice combination. There's no rule that says you have to become a lawyer if you get a JD. As with the undergrad, the same recommendation applies when you're in grad school, that you should get as much hospital experience as you can, no matter what you're doing. So if you're doing nursing or medicine and you're already spending a lot of time in the hospital, this doesn't really apply. But for everybody else, you should try to get some hospital experience. In grad school, there might be some more options that are open to you that an undergraduate doesn't have. So you should reach out to the clinical ethics team if you're in a city, figure out who the clinical ethicist is at the hospital. There will almost certainly be one at a medium or larger size hospital. See if you can shadow them every once in a while. See if you can attend any meetings, so you're not necessarily meeting with patients. You can, if it means just volunteering to kind of like get your foot in the door, that would be great too. You just want to show that this is something that you're actually interested in, that this isn't, clinical ethics isn't just something that you kind of like switch to spontaneously. So you show that you're interested in it and you get some more experience. And it can also lead to a reference, which is really helpful when you're applying to jobs or for the next stage for training. So do whatever you can to get into a hospital. The other thing that you can look into is, it's not exactly clinical ethics, but research ethics is a really well-developed field. And because in Canada and the US and most other countries, there are really specific laws that researchers have to follow if they're going to do research on human subjects. So if you want to do an experiment involving humans, that could be like a pharmaceutical trial or a psychology study, you have to get the approval of an ethics board. In Canada, those are called research ethics boards, REBs, and in the United States, those are called IRBs, or institutional review boards. So every university will have one of these. This is not exactly clinical ethics, like I said, but if you can volunteer for that or get on that board or just participate in some of their meetings to see how it works, that is another great way to get some experience of seeing how ethics decisions are made. Okay, so you are working your way through grad school, whatever that is, and now you're trying to think about next steps. Once again, it depends a little bit on what you're doing, but there are two options. One of the options is to do a postdoc or a clinical ethics fellowship. So as I mentioned, that I went to Baylor College of Medicine after I finished my PhD, and that offered me training, but also training in clinical ethics, but also some research time. So I could keep developing my academic research, which was in bioethics then. There are other fellowships or postdocs that have more research and less clinical ethics, or more clinical ethics and less research. Once again, I'll post some links to various fellowships so you can have a look at what they offer. That is the kind of main direction that you want to think about, especially if you're interested in doing any kind of academic work. So if you want to be based in a faculty in a med school or in a philosophy department or any other kind of academic institution, then a fellowship is the best bet to get that experience. If you're not interested in that level of position, if you just want to go straight into clinical ethics, a fellowship is still something really worth considering, especially if you did a degree like philosophy, because philosophy does not really give you clinical ethics training. So you'll need some more training to be able to go in to become a clinical ethicist. So you can think about a fellowship, but the other option is that you can look around, see what's available, and look for some junior clinical ethics positions. So it might be possible to get a position where even if you don't have that much clinical ethics experience, you can take a position and there will be kind of some more training, or you'll be working underneath an ethicist as you get more experience, and then you can go from there. The advantage of that is that you go right into working in a hospital as a clinical ethicist. The downside is that without the fellowship, then that restricts your options if you're thinking about going into any kind of academic program. So there are many places, such as Baylor College of Medicine, where the faculty work as clinical ethicists. They rotate through being on call, but the rest of the time they're doing their own academic research, or they're teaching medical students, or they're working on policy. The last piece of advice I want to give is that you should reach out to some clinical ethicists nearby you. So if you live in a city where there's a hospital, there's a very good chance that that hospital has at least one clinical ethicist. So try to figure out who that person is, contact them, take them out for coffee and ask them some questions. See if you can hang out with them. It is hard to get clinical ethics shadowing experience because it means that you have to be spending time around patients. So there are confidentiality reasons that clinical ethicists, as well, just like any healthcare provider, that they don't want people kind of hanging around meeting patients and so on. But if you can get any kind of experience, attending meetings, going to ethics board meetings, like I mentioned, if there's an ethics committee at the hospital, which is getting far less common in Canada, but is still many US places still have ethics committees, see if you can attend those. You might have to leave when they talk about an actual case, but you can still kind of participate. Any of that stuff is great experience and will really help you out. Because clinical ethics is changing so much, having somebody you can regularly kind of get some advice from about thinking about next steps or how to kind of progress in your career, that will be really helpful. It will also be really useful to have somebody that if you can spend some time with them and if they can attest to your ability, you show up on time, if you do get to meet some patients, that you're polite and you are a nice person, you're easy to talk to, you don't just start arguments all the time. Any of that is going to be really helpful for when you try to get a clinical ethics fellowship or when you try to get a job as a clinical ethicist. So reach out to people and try to get in touch with them. That's it. Thank you so much for watching. If you have a question, leave a comment down below and I will answer it.